Dr. Sean Palfrey has been a pediatrician, teacher, and advocate for better child health policies in Massachusetts since 1974. He's worked and taught at Harvard, Tufts, UMass, and Boston University Medical Schools, and is currently a professor of pediatrics and public health at Boston University and Boston Medical Center.
I've run lead poisoning prevention programs in central Massachusetts in the 70s and 80s, and then since 1989 have run the Boston Lead Poisoning Prevention Program here with the Boston Public Health Commission at Boston Medical Center. And pediatricians screen your children for lead poisoning at 9 months, usually 9 to 12 months, and then 18 to 24 months. So almost every child in this state gets screened at those ages. Massachusetts is wonderful for a number of different public health reasons, and I'm very proud to be a part of this team because we screen kids much more closely and much more consistently than any other state. And the primary source these days for lead in their environment is in the old paint that happens to be out there, or the dust that gets stirred up when people are renovating their houses. It is not from water. It is no longer from gasoline. It's no longer from soil, although these are sources. So when a child gets referred to us by their pediatrician, us being the clinic that I run at Boston Medical Center, we will go out and we will look across all the sources of lead in their environment. One of the things about this current issue of lead in the water at schools is that older children than age 4, 5, 6, and we as adults, are very rarely significantly poisoned at all. And the reason that's true, one is that older children are not at the level of eating paint. Paint, by the way, is sweet and chewy, and kids will go back and eat it. So that's why we focus so much on lead in paint. Lead in water is very rare, and as the commissioner said, if you run your tap for 30 seconds to a minute to bring the water temperature down to cool, you are going to have essentially none, even in a house that has some lead in the pipes coming into the house. So the source of lead poisoning from water in this state is minuscule. So I, as a pediatrician, and I, as a lead poisoning expert, am not worried, and I want to reassure the parents who are in this room, that their children have been poisoned in any significant way at all from the water in the fountains in the Boston Public School system. That's not where our problem is. We will work for it, and as you've heard, we are very meticulous, we being the city and the state, to try and get rid of any fountain that might have some lead in the solder or lead in the pipes. And we are working at every level to try and get the lead out. But to be very honest and reassuring, this is not the source that we need to worry about. If any of your children had elevated lead levels as 1, 2, or 3-year-olds, I probably have seen them. And if I haven't seen them, then my colleagues in the Boston Public Health Commission have seen them and been out to the houses and investigated the sources in the houses or in their environment, including the schools.